I'm David Diehl. I'm Director of Interventional Endoscopy at Geisinger Medical Center in Danville, Pennsylvania. Well, I was on call that night, and there was an elderly lady who had a very large GI bleed, an upper GI bleed. We did an endoscopy, and there was a very large, a giant duodenal ulcer, and it was bleeding profusely. It was very hard to see anything. Clearly, none of the available methods that I had would work. No cautery probe, no clips. Nothing was going to stop the amount of bleeding that I was seeing here. But I was very happy that I had the Hemospraye. I was able to use the Hemospraye, and within 3 applications, I was able to completely arrest the bleeding. And what was very remarkable to me was it struck me that this was the only device that I had to help this patient. Duodenal ulcers are the most common location of ulcers. A giant ulcer means that it's more than 2 centimeters, and the larger they are, the harder they are to control because they could have multiple bleeding points. In this case, there was diffuse oozing from one area, and there was a pumping vessel from another area. Very challenging ulcer to treat endoscopically. A patient like this would be very hard to manage before Hemospraye. It's because of the large size, because of the diffuse oozing, standard hemostatic modalities just would not work. I might have had to send the patient to surgery, possibly interventional radiology to embolize a vessel, but I would be helpless to aid this patient endoscopically. I think the availability of Hemospraye has changed how I look upon severe GI bleeding. I now think about going to Hemospraye earlier in the course rather than perhaps trying other modalities that I think are unlikely to help. So it's changed the paradigm for me for severe GI bleeding. This case really underscored for me that this is an important product to have on the shelf, to have available in cases of emergency. And just having that available, I think will change how I view some of these very difficult cases where I may have, sent them to surgery right away. At least I have something to do for them now. For management of upper GI bleeding, we of course have all the standard modalities, for example, epinephrine injection, clips, cautery probes. Those things are available, and for the appropriate patients, they're still appropriate to use. However, in some situations where there's a lot of bleeding, a very large lesion, diffuse bleeding, tumor bleeding, lesions that are very hard to control with standard devices, it's nice to have the Hemospraye available.